Welcome back. You're watching Healthy Living live from our studios here at the Redemption City of God in Nigeria, and this is Dove TV. So today we are looking at care for the elderly. So have you got an elderly person at home? Say your parents, your grandparents, your in-laws. Now you need to pay rapt attention to what we're about to discuss so that you can know how best to actually take care of them so you can enjoy their presence. You know, sometimes the elderly people come with their unique character or their unique attributes or their unique presence. So you need to understand them. Okay, that's why we have an expert in the house who is going to help us understand how best to care for the elderly around us. And in the studio now, I've been joined by the medical director of Redeemers Health Center at Ifewara, Ocean State, Nigeria. His name is Dr. Olumide Ibode. Thank you so much, sir, for joining us today.
Thank you, Lillian, for
How
having
are
me.
you doing, sir?
I'm doing very great today.
And how is Ifewara in Ocean State?
Wow, very wonderful, serene, natural, and it's a place of refreshing.
Right. Thank you so much always for joining us on Healthy Living.
Thank you very much, Lillian.
So, just before you came up, we actually discussed kind of exercise that the elderly people need to engage with. That's because our focus today on Healthy Living is care for the elderly. And I know that for some time now you've been talking about how best to care for the elderly because there are special people around us and we must care for them. Now, from your experience and knowledge, tell us how best should we take care of the elderly? Oftentimes we see them, we notice that they forget things a lot. Oftentimes we discover that these older ones, they are harsh. And sometimes they think they know so much when we are trying to advise them. So how best should we care for the elderly, sir?
Okay, thank you so much. We should care for the elderly with understanding. We should understand them. Of course, you know already that elderly people, which we call older persons, are people 65 years and above. Now, when we begin to approach that age, a lot of changes take place in our system. The digestive system changes, the brain changes, the respiratory system changes, the muscles, the bones, everything undergoes change over time. Now, when we have that understanding that these elderly that are forgetting things, they are not forgetting things because they want to forget things, but changes are already taking place in their brain. They are not being edgy or harsh because they want to be edgy or harsh, but it's because of the changes that are already taking place. You know, there are about 3 ways of aging.
Okay.
About 3 ways of aging. Some people age successfully. They age successfully by retaining all forms of functions they had when they were younger. Some people age normatively. Normatively means they are still able to carry out their activities of daily living, they are independent, and so on and so forth. But some people age in a very frail manner. They age in a very frail manner, meaning that at 65, at 60, they are already out, they can't live independently, they can carry out activities of daily living, brushing, bathing, cooking, driving, using tech and all that. So we must handle them and treat them from the point of understanding. And that's why in medicine, the general doctor is not the suitable doctor for taking care of elderly. We have a specialty that takes care of elderly, which is called geriatrics or gerontology. So these are doctors and nurses trained specifically to identify issues in elderly, manage issues in the elderly, and treat them with compassion, with empathy, with love, and so on. Thank you very much.
Thank you so much, sir. Well, I'd like you to know that our phone lines are now open. We'd like you to please connect with us as we have this conversation live now on TV. You can call the number designated for calls or send us an SMS to the number designated for SMS, and we'd like to hear from you. God bless you for joining us. Now, one of the traits we discover in the elderly, one of the things that we notice is that some elderly like to walk about. Why? Is that normal? Or what? Why do they just want to walk about?
It's not, of course, no, we have advised
Yes.
the previous speakers talk about exercising.
Yes.
But when we talk about walking about, we should ask ourselves, is this walking about aimful? Are they walking about aimfully or aimlessly? If it's for exercise, if it's for relaxation, fine. But if it is aimless walking about, then it could be traced to certain disease conditions. You know, as I said, there is cognitive decline with age. There is a particular disease entity that we call Alzheimer's disease and Parkinson's disease, which will make elderly people to walk aimlessly at times. So, and at times they could walk aimlessly to the point that they could get missing. They could get lost. So we have to be careful when our elderly are walking about, and we always advise, don't leave them alone. There should be somebody with them at home. There should be somebody with them when they are taking their walk, their prayer walk, their exercise. They shouldn't do it all alone. So the cause or the reason behind walking about is not because they want to walk about. It's as a result of the decline that is taking place in their central nervous system.
Right. Thank you so much, Doctor. Now, one thing we also notice about the elderly is the falls. The elderly have this tendency of falling. Talk to us about the elderly falls.
Yes.
Falls in the elderly.
Yes. Falls are a major disease entity, major issue in the elderly.
Okay.
In fact, about 370 million falls occur worldwide.
Wow.
And in the United States alone, 300,000 people are admitted in the hospital because of falls. And about 30,000 of them die because of falls. And the government of the United States spends nothing less than 30 billion annually on falls. So falls are a major issue in the elderly, and there are so many reasons why an elderly may fall. What is a fall? To start with, it is to descend from a vertical position, unintended descent from a vertical position to a horizontal position, or you lose balance and you fall unintendedly with the potential of sustaining injury to any part of the body. So falls are a very important thing, and we must put measures in place to ensure that they don't fall, because they could get injured, they could hit their head, they could hit their hands and break their bones. They could hit their legs and break their pelvic bone or any bone in the body, which could result in a lot of long stay in the hospital, a lot of expenditure, reduction in quality of life, and even death at times.
And when that happens, they don't heal easily because of their age. They don't heal easily. Because I remember a time, yes, when my grandma actually had a fall, and it actually took a whole long time before she could walk.
Yes, with age, in children, when children sustain bruises, cuts, or fractures, within weeks they have healed. Adults, middle age, within weeks or months they have healed. But for a fracture to heal in an elderly, it could take up to 6 months to a year, if not more than. For a wound to heal in an elderly, it may take months. So we want to prevent it. We don't want it to happen. Now, when an elderly falls and hit their head, they could develop what we call concussion or contusion, or they could bleed into the brain.
What's contusion? Okay,
contusion is a localized injury to the brain as a result of hitting the head against a hard surface. While a concussion is a more widespread injury to the brain as a result of hitting the head against a hard surface. But in the surprising thing, in elderly, when they fall and hit their head, at times they don't develop symptoms immediately. It may take weeks or months. When they have even forgotten they fell, and nobody could trace it down to that particular fall. So they could start forgetting things. They could start getting edgy. They could start vomiting. They could start having severe headaches. They could even lose consciousness, and one will be wondering, why is this happening to grandma? Why is this happening to grandpa? Not knowing that the fall that happened 6 weeks ago is the one responsible, resulting in slow bleeding into the intracranial cavity and causing all these symptoms. They could even have seizures. And one will not. So when they come to the hospital, the doctor has to have a high index of suspicion that most likely a fall might have happened or occurred at home, and the doctor should request for a CT scan of the brain or an MRI to diagnose whatever has happened to the brain.
You know what, doctor? Talking about being heady and sometimes they could be very stubborn. I saw a clip, a video that someone sent to me about someone who was actually, a caregiver to an old woman somewhere, I don't know, one of these countries abroad. And she wanted the woman to come have a night bath. It took them like more than 30 minutes. It took her more than 30 minutes to actually convince this grandma that she needs to have her bath. Grandma, it's time for you to have your bath. And she said, why do I have to have my bath? And she said, you need to have your bath so you can enjoy your sleep. Who told you I will enjoy my sleep? And she said, Grandma, you need to stay healthy. You need to stay fresh even as you go to bed. The grandma kept asking why. Why? Oh, no. Oh, no. But like 30 minutes just to convince. I'm like, the grandma was just acting like a child.
Yes, that's what happens. We need to understand that as we grow from childhood to adulthood, we reach the climax of our physiological function at the age of 30. Physically, biologically, every aspect, every function in our body peaks at 30. Then afterwards, decline sets in, and the rate of decline depends on many factors.
Okay.
Now, for the elderly, 60 years and above, or 65 years and above, depending on your reference,
Okay.
we need to understand that these are special people. As we have pediatricians taking good care of babies, we can't just allow any doctor who is not trained in taking care of babies to take care of babies when it comes to certain care in pediatrics. So also we have people that have been specially trained to be patient, to demonstrate empathy. They are specially trained in taking care of elderly people.
Ones.
So when you are arguing with somebody, an elderly is asking you, why should I have my bath? You should be patient enough to explain and to keep explaining, because you cannot force her to have a bath. Because if you try to force her, in the process, you may get injured, the person may get injured. So there are carers in caring homes that are specially trained to communicate with elderly. There are nurses that are specially trained to communicate with the elderly. There are doctors that are specially trained to communicate, to deal with them. As a matter of fact, you come down to their level because you deal with them with the understanding that these people are now like children.
I know somebody who says, I can't talk to my parents. When this person wants to convince his parents to actually do something, he would have to go and call his friend. Well, you are the only one that can talk to them. They listen to them. I mean, I don't have that patience. You don't have patience to talk to your parents.
You must have the patience to talk to them, because you understand that one day you become elderly to yourself, and your children will have to find out how they will communicate with you. Because those declines, those changes will occur in you too. Although I said it occurs at different rates. Some it occurs fast. At the age of 50, they are already so old. Some at the age of 90, 100, they are still firing. They are still very active mentally, physically, and in all ramifications. So as children who have older parents, we must learn to come to their level and relate with them. But I must agree with you that we have different skill sets. Some people have more patience in dealing with elderly than others.
All right, sir. So since we're talking about falls once again, sir, how do we prevent falls in the elderly? Because we know that definitely they have this tendency of falling, and we have them around us. How do we prevent these falls?
Yes, prevention is better than cure. Prevention is better and cheaper than cure. Now, there are so many things that can be done to prevent falls in the elderly. Now, I will just advise the elderly who might be listening and who might be following this program. If you realize you are feeling dizzy and you are about to fall, it's better you fall down intentionally and lie flat than for you to fall unconsciously and hit your head. You understand? When you realize you are feeling dizzy, it's better you either sit down or you just lie flat on the floor intentionally, rather than really falling down and banging your head or banging a particular bone in your body. Then the other way we prevent falls in the elderly, we should take them for annual checkup. Let's check their eyes. Some people fall because they are not seeing clearly due to cataract or glaucoma. Some people fall because they have poor balance as a result of dysfunction in the inner ear, because the ear is responsible for hearing and balancing. So when we take our elderly for annual checkup, the doctor checks their eyes, check their ears, check everything to ensure that. Then there are disease conditions common in the elderly, such as hypertension that can cause orthostatic or postural hypotension. There are disease conditions like diabetes that can make your blood sugar low or high and may result to fall. So these disease conditions should be managed appropriately, and we should check their medication. One thing we notice in the care of the elderly is that elderly, they practice what they call polypharmacy. You will see an elderly coming to the clinic with about 15 different medications. This one is for back pain. This one is for headache. This one is for this. So,
but you don't blame them. They're actually going through all of those things now. Because
So-
it's like, I don't understand this one like this. My son, what do you think?
So as geriatricians, what we do
Yeah.
is to, if you are going to practice polypharmacy at all, it will be appropriate polypharmacy, not
Polypharmacy is
inappropriate.
when you are going to take different drugs. Or
Too
what?
many drugs, or maybe more than 2-3 drugs for one
Prescribed
prescribed,
or
maybe
self-medication.
mostly self-medication.
Yes.
Then at times prescribed, prescription should have a limit, but they will keep buying and buying and buying and replacing, and multivitamins sent from the US, from the UK, from their children abroad.
Who want them
they
to
keep
stay long and
so
stay healthy too.
some of these drugs can predispose to fall. So as geriatricians, we try to help them separate those that can predispose to fall from those that cannot predispose to. Then another way to prevent fall in the elderly, before I go to the home setting, is when you wake up in the morning, don't just get up out of bed and go to the restroom or walk out like that. When you get up and start walking immediately, you may fall because of what we call postural hypotension, which is common in the elderly. So we usually advise that you're getting up in the morning should take about 3 to 5 minutes.
Okay.
First of all, you wake up, you are sure you are fully awake, then you move away from the edge of the bed, you try to put your legs on the bed, you turn to your side, you sit up in bed
Okay.
for about 2 minutes
Before standing up.
before standing.
So after you have adjusted yourself as an elderly person trying to leave the bed, you sit for a while.
Before standing
Before
up.
standing up,
Then when
okay.
you now stand up, you stand for a while and be sure you are not feeling dizzy.
Okay.
Make sure you are holding something. You are not feeling. If you are feeling dizzy, sit back. If you are not feeling dizzy, then take your gradual steps to wherever you are going. The other way you can prevent falls is to make sure that the home setting of the elderly is appropriate and elderly friendly.
How do you mean?
What I mean is that we should avoid tiles that can make them slide and fall.
Yeah.
The home setting should be well illuminated.
Okay.
There should be color contrast so that they know when they are approaching a wall.
Okay.
Bright colors, color contrast. In the bathtub, there should be hand grabs.
Right.
There should be rails, handrails, so that when they want to fall, they can hold
Have something
onto
to hold on
something.
to, yeah.
We have anti-slip rug,
Right, yeah.
anti-slip rug
Yeah.
or anti-slip carpet. Ensure that everything they need for activities of daily living, particularly when they grow older, everything is available at their reach. Not that they have to go upstairs, downstairs, move up and down before. Everything is available at their reach. And lastly, we should ensure that our elderly don't live alone. They are not alone at home. When they are not alone, when they are alone, if a fall happens, nobody might
will
know.
there, yes.
But if somebody is there right there, the person will come, will help, and will be able to escalate and do the necessary thing. Then what other people do?
You know why some of them, well, as much as it's not good for them to be alone, I know people complain a lot about this elderly because they could be very annoying. You know, sometimes be like, you just stay, let me see if you can just handle yourself. Let me see if you can just take care of yourself. Because there are times you send one particular nanny to them, after a while they complain, this one, she doesn't do anything. They complain a lot.
If grandmas, grandpas keep complaining, we'll try and explain to them, make them understand that Mama, you can't stay alone. It's risky. I'm not ready to buy cows now. I don't have the money. I want you to live long until your children's children and your great grandchildren. So we need to be empathetic. We should try and convince them. And please, when we have carers who are not family members, we can install CCTV at home and make sure that these carers are not maltreating our elderly. There have been instances of carers really maltreating elderly, particularly those ones that maybe that cannot communicate appropriately and give feedback to their children. So we can have CCTV installed at home, and we as their children, we must be available for them. We must communicate with them. They want to hear the voices of their children every day. They want to hear them every week. Don't just be sending money to grandma, be sending money to grandpa. Please call and make sure you visit grandma. Make sure you visit grandpa. So it's very important that we treat them uniquely, treat them like kings and queens.
I know a grandmother said she was going to commit suicide. Why? Because she felt abandoned. She said, nobody, people are not caring. You're not sending. They are sending things to her. But she said, I don't hear your voices. I want to hear your voice. That's what matters to me even at this time. And she said, for that reason, if you don't call, she'll commit suicide. Like, see this old woman.
Sending money is very important.
Yes.
Of course, we need that for the upkeep of our grandparents. But our physical presence, or even our virtual presence, making phone calls, making video calls, is very important. They appreciate it at times more than the money we send.
More than the gifts. All right, let's take this. This person says, Calvary greetings to you. Please, what causes profuse sweating and dizziness in an elderly person who is diabetic and hypertensive?
Yes, a diabetic and hypertensive elderly
and profuse
could
sweating.
Have many reasons for having profuse sweating.
And
one of them is hypoglycemia. Hypoglycemia means low blood sugar. Okay. No, as elderly, their appetite is not as good. As I said, even their gastrointestinal system, GIT, is aging. So they don't have appetite, they don't feel like eating. So they could be taking oral hypoglycemic agent, that is drugs for diabetes, without eating. That can tilt them to very, very low blood sugar, which will result in profuse sweating and dizziness, and at times they might even pass out. Then when the blood sugar is even too high, as a result of not taking their medications as at when due, they can have this experience also. Then I did mention postural hypotension. No, in younger people, when we stand up, our blood pressure when we are sitting and when we are standing is not significantly different. But in older persons, their blood pressure when they are standing comes down sharply.
Wow.
Their BP comes down sharply, and they could start sweating. They could lose consciousness. They could fall. Right. So that's why I did say earlier that elderly should not just stand up and start walking. Okay. They should take about 5 minutes to stand up so that the blood pressure will normalize, will equilibrate to what is supposed to be. There will be circulation to the brain, enough blood supply to the brain, and within 5 minutes, they can now walk to wherever they are going, maybe to the restroom or to the kitchen or anywhere else they are going. So those are the causes of those conditions or complaints in hypertensive and diabetic elderly.
All right, sir. Oh, before we continue, let me quickly take this call from Tope, who has joined us from Lagos. Hello, Temi Tope. God bless you for joining us live. Hello.
Hello.
Right, you're live here in the studios with us. Please go ahead and ask your question.
Okay, I just want to say a very big thank you with Dr. Ibode and Sister Lillian, which are talking about helping people. I wish I'm home with my mom to be able to give her what she's got so she can hear what they're saying. I don't know how often this elderly program will come up again.
Right.
Because I just have to leave where I am now, which I'm not able to finish, for the program.
Okay, Temi Tope, God bless you. Thank you so much for watching. Where Healthy Living comes up every Thursday, 10 a.m. Nigerian time. But I don't know the next time we are going to be talking about the elderly. But you can always watch a repeat of this on YouTube. Yes, it's on YouTube, so you can always watch previous episodes and this particular episode much later after today. God bless you. Please stay with us. We have about 10 minutes to actually wrap up. We'd like you to stay with us to the end. All right, sir. Please go ahead. All right, so still talking about, yes. Okay, so how do we manage these falls when an elderly person falls? This problem that might just come up, how do we manage them when we have them at home?
Yes, management, as I said earlier on, prevention is always better than and cheaper than cure.
Yeah.
Now, when an elderly falls, there should be somebody there. They shouldn't be alone. So there should be a carer, a family member, someone there who would attend to them and give first aid. Some falls may be non-traumatic. So, like every year, 1 in 4 elderly falls down, as I said. So falls happen per second, practically every time. So falls that don't result in injury, no injury to the head, no injury to the bone or anything, we could still come to the hospital for review, for checkup to ensure that there is no injury. But there are certain falls that probably result in loss of consciousness. That one, wherever you are, you must call 911 or get to the hospital as soon as possible. Or there is no loss of consciousness, but the elderly that fell just realized that he or she cannot get up. There might have been a fracture, which you may not be able to diagnose right there. So the elderly should be gently brought up, carried up, and conveyed to the hospital for care. So the management depends on the kind of injury sustained. When an elderly falls, for instance, and the elderly gets up and says, I'm okay, but you can see a slight bruise on the head or a swelling on the head.
And you tell them they need to go to the hospital, and the person said, I'm fine. I told you I'm fine.
We have to convince him
them that have
or
to go
convince
to
her
the
to go to the hospital because there might be something going on deeper in the brain.
Thank you so much. So let me quickly take this call from Olushola, who is joining us live. Hello, Olushola.
I took him to the hospital. He was on admission for several times before he was being discharged. But up to now, he can see, he can eat, but the right hand side, he cannot still make proper use of it. And he can't walk. And we will use therapy.
All right.
All right, thank you. Let's hang up and listen to Doctor. Did you make a point from what she was saying? Okay. All right, thank you.
So the question is about the grandparent who fell and spent time in the hospital, and up till now, although has been discharged home, but cannot move a particular part of the body. Now, it is likely that the person might have developed a stroke. In fact, strokes are a cause of fall in the elderly. It's likely the person has developed a stroke, which can be diagnosed both clinically by reviewing the patient history examination, and more importantly, radiologically, by doing brain scans. So it's the brain scan that will tell us if there is cut off of blood supply to a particular part of the brain, or there is a bleed in the brain.
All right, sir. Well, I know that you might not be a nutritionist, but you care for the elderly people. So we'd like you to please advise us. What would you advise the elderly to take? What would their meal look like?
All right.
For an elderly person who wants to stay healthy and someone who is caring for an elderly person.
Thank you for the question. Talking about meal, I will talk about both water and food.
Okay.
Dehydration, not taking enough fluid, is a cause of fall in the elderly. So elderly should be well hydrated all the time.
Okay.
They should drink water as much as possible to make sure that they are well hydrated and their electrolytes are balanced. Then, talking about food, I said earlier on that the appetite may be so bad, they may not feel like eating. They may not even feel hungry. And the blood sugar is already getting low.
Right.
So we advise them that they should have scheduled time for eating.
Okay.
So rather than take something that is more voluminous, more huge plate of food, you could take small bits, more frequently, small portions.
Let me quickly take this message, Doctor. Somebody says for an elderly person who is addicted to some substances like tobacco, leaf, coffee, cola nut, etc., should we allow them to continue, or how do we stop them?
We shouldn't allow them to continue. These substances are addictive. These substances have their deleterious effect on the heart, on the kidneys, on the liver, because these are the organs that process them. These substances can lead to unconsciousness and result in fall in the elderly. These substances can affect their sleep and make them have insomnia and poor sleep and so on, which might result in things like confusion.
So we
must discourage them from taking addictive substances.
Why does it seem that the elderly don't or smell somehow, and their mouth smells, and they have some kind of odor? What do you do? Since we are talking about caring for the elderly.
Okay, are you talking about the mouth odor?
It's a question, yes, that some elders have mouth odor, they have smell, they have some kind of odor.
Okay.
Their rooms and all of that,
The truth of the matter
is
that odor, that is repulsive odor, is not attributable to the elderly.
Okay.
It's a matter of hygiene. It's not that as you grow older, your room will start smelling, or you will start smelling, or your mouth will start smelling. No, it's a matter of personal hygiene. So when we work on their personal hygiene, brushing their teeth, keeping their nails trimmed, keeping their environment tidy, and having somebody at home to help them, because they may not be strong enough to clean every time.
Right.
So having somebody around to clean the environment. So odor is not
Has nothing to do
attributable.
with
It's not
age.
synonymous to
To the elderly.
To the elderly.
All right, thank you so much, Doctor. We need to wrap up this conversation, but it's been an interesting time on television. Someone says, good morning, please can I get the contact of the doctor? We need this kind of talk on elders regularly. Well, thank you for enjoying that. Well, doctor's number will be displayed shortly on your TV screen, so you can contact him just after the program. As you can see, Dr. Ibode's number is right there on your TV screen. God bless you, everyone, for being a part of this edition. Dr. we must say God bless you too. Thank you so much.
Lillian. Thank
Well,
you.
it's been an interesting time, but we cannot leave until we thank God for his for leading us. Please lead us in short words of prayer, sir.
Shall we pray? Our Father and our God, we thank you for this opportunity you have given unto us to minister and talk to our older and senior citizens. It is our prayer that, Lord, that you will keep them stronger and healthier. You keep them healthy physically, spiritually, and let them enjoy the fruit of their labor. Don't let them live their old age in sickness. Don't let them live their old age in sorrow. Don't let them ever weep, oh Lord. Let them become and continue getting stronger and stronger in their old age in Jesus' name.
Amen.
We also pray for ourselves that are younger, that you will give us the grace to live long and healthy and prosperous lives.
Amen.
Thank you, oh Lord, for Dove Media Television. Continue to bless this TV station. Continue to bless the Redeemed Christian Church of God. In Jesus' mighty name we are prayed. Amen.
Thank you so much, sir, for your time with us on the program. And my guest today has been Dr. Olumide Ibode, the Managing Director of Redeemer's Health Village at the Ifewara in Osun State, Nigeria. My name is Lillian Ogedegbe, and on behalf of the production crew, God bless you. Stay healthy, take care of yourself and the elderly ones around you. We see you again next time. Bye now.